Well, the latest findings revealed at the 58th SACENDU Symposium shows that there is a concerning rise in alcohol and drug use among young people in South Africa. The Gauteng province accounted for more than half of all admissions to substance abuse treatment centers across the country. Teenagers between the ages of 15 to 19 makes up 26% of all admissions in the province, up from 19% in the previous reporting period. To discuss this further, we are joined on the line by Nancy Hornsby, and she is a senior scientist from SAMRC's Mental Health, Alcohol, Substance Use and Tobacco Research Unit. Nancy, good afternoon, and thank you for joining us on Africa Update.
Good afternoon. Good afternoon to you and your viewers.
Nancy, I mean, these are shocking figures. I mean, 26% of all admissions in the province, age group between 15 and 19 years old. It would be interesting to also find out what makeup this is, whether what percentage are female and what percentage are male. Tell us more about the South African Community Epidemiology Network on Drug Use Symposium and how the study was conducted.
Right. So SACENDU is an ongoing surveillance system. So we provide ongoing drug surveillance on treatment admissions for substance abuse across the 9 provinces in South Africa. So we identify emerging trends, what are new substances of choice that people are using, what substance is being replaced by, because we look at the trends over the years. So really that's what it's about, so that we are preemptive in our response instead of always being reactive. So we use it to have more of a predictive stance on where to focus or target services. So that's really, in a nutshell, what the study or the project is and the purpose of it. So we cover, as I said, all 9 provinces, who have about 82% coverage of treatment centres. So the system is voluntary. Treatment centres provide their treatment data to us, so based on different questions that we've designed on. We have a standardized data collection form that treatment centers complete, and that's how the information is then fed through into our system. We curate and analyze and then disseminate the information.
Now, let's talk about, some of the factors that play or lead the youth to becoming hooked on drugs, and just the results of the study in terms of drug users and the amount of drugs used.
Mm-hmm. So in terms of the profile, so as you said earlier, 15 to 19 years, that's the main age group, and that age group have overtaken the age groups that we've seen in previous years. So where they tended to be mostly young adults to young adults. It's now mainly adolescents, and we've seen this trend in the last 3 periods. So we report our data by 6 monthly periods. So over the last year and a half, we see this alarming trend among adolescents, and it's mostly males who are accessing treatment for substance misuse. Males with a high school level education. So that high school level education doesn't refer to their current grade. That refers to the highest level of education that they've completed. So it's males with a high school level education. They are mostly unemployed. About 50% are unemployed. And just over a quarter, 26%, are high school learners. So you see, of these youths, half are unemployed. So that's really the profile that we see. And we know that it's not to say that the problem is any less bigger among females. It's that females tend to underutilize treatment access. Because remember, this data is around treatment access, individuals who access treatment.
Just for interest's sake, do you also
Mm.
look at race?
We do, but we don't report on it because you have to be very careful. So it really has to have meaning. Because we do see that in Gauteng, for example, it's mostly Black African individuals that are admitted. Same for Western Cape, where it's mostly coloured individuals that are admitted to treatment or seek treatment. But we are a bit careful with the race variables because of all the connotations around it, and it could be simply because of the population makeup.
All right.
Yeah.
Do you also find that we look at what is this, the hookah pipe? Why is it a cause for concern? And just are these young people being targeted? How do they get into drugs?
Well, let me answer the first part of the question. The reason for a lot is the health consequences associated with hookah pipe. Now, there's this misguided conception that it's healthier. There's been this idea that it's healthier because it uses water, all sorts of beliefs or misguided beliefs around hookah pipe. But we do know that hookah pipe is associated with chronic obstructive pulmonary disease, emphysema, lung disease, asthma. Because of the toxins, the hookah pipe contains a high concentration of toxins like carbon monoxide and nicotine. Add to that sharing of the mouthpiece. So now you have an increased risk of disease like TB, herpes. So that's the harms that we found that's linked to hookah pipe, but we do need more long-term data or studies.
Okay. And because of time, I just have to come in there and wrapping up 15 seconds. What do you do with this information?
We disseminate on various platforms. So our information is fed through to the Department of Social Development, the National Department of Health. We also feed it through to international fora. So the United Nations Office on Drugs and Crimes, the WHO report, World Status Report on alcohol and drugs. All of that information is taken from SACENDU on the South African stats.
Nancy, thank you so much for joining us. We leave it there for today. That's Nancy Hornsby, a senior scientist from SACENDU, SAMRC's Mental Health, Alcohol, Substance Use and Tobacco Research Unit. And that's how we wrap Africa Update today and for the week. It's been a great one.